Yes, Stikanome. Hi, welcome to my YouTube channel. My name is Rose. If you're new here, please consider subscribing. For my subscribers, thank you so much for your support. Okay, so I know that I haven't posted for a while. I trust that your spring has gone well. As for us, it's been quite strange. May has been really cold. Actually, it's only yesterday and today that we are actually having like a normal spring or pre-summer day. So anyway, I trust your spring has been good. So I got a lot of videos lined up for you, but I must get this one out of the way because it's something that I kept saying that I'll talk about, but I actually didn't make that video. So today we are talking about healthcare and senior care on Crete. The thing is, when it comes to healthcare here on the island and Greece at large, we have a lot of highly equipped medical facilities, okay, and we have highly qualified doctors. At some point, the WHO actually ranked the Greek health system as one of the best in the world. But we must keep in mind that the economic crisis that Greece has faced in recent years has of course impacted different sectors, health sector included. Okay, so what I can say is that even though we have like really high-tech hospitals here on the island, a lot of public hospitals are underfunded. And what this means is that first of all, there are no nurses. Okay, I know nurses are missing. A lot of hospitals around the world are missing nurses. But here in Greece, and especially here on Crete, I feel like there is a shortage of nurses, and the island could use, trained nurses. I spoke to one of our friends who had an accident, and he had to be admitted in the general hospital in Hanya. And I got talking to him because obviously I wanted to do some research about this topic, so I can make this video, and also I can write the article that I wrote on my blog. Please, I beg you, please go and read that article, because I'm not going to be able to put all the information I shared on the article on this video, because then the video will be too long. And I've actually had some people on my comment section talking about that the way I talk and I'm rambling and they can't pay attention. Just to mention a bit on that is that, first of all, I'm very proud that I can communicate in this language, because English is not my language. It's a foreign language that I have learned. So I am very, very proud of myself for being able to actually send my messages to people out there in this language. So anyway, I just want to say that when I spoke to my friend and how, his situation went, him and his wife, they were stuck in a situation where actually the wife needed a private nurse to help her out. And that was actually a challenge. And because here in Crete, most of the hospitals are some of the duties that nurses are supposed to, to perform, they are actually left for the family members. Okay, the family members are supposed to take care of, let's say, the bedpan help and emptying bags and feeding the patient and taking care of the hygiene of the patient. And it became very complicated for our friends, because obviously she needed some help, to help her husband. So this is one of the things that I feel like you need to think about. Like, if you end up in the hospital, you need to know that some duties that a nurse is supposed to perform are actually left for family members. So if you don't have a family member living on this island, then of course it could be a challenge for you. Now, there's this company called Care in Crete that promises to offer you those kinds of services, where they can give you somebody who will actually sort of take part of the family. And they give a lot of services according to their website. They say they can even offer transportation from and to the hospital. They also say that they can offer a translator who can ask questions on your behalf when talking to the doctors. But I must say, it's been my experience here on the island. When you visit this website, they look very professional. They look like, they're promising a lot of things. But when you get down to it, things are different on the ground. So I haven't personally, as I say, I haven't really dealt with these people, so I cannot really recommend, because one of the reasons why I feel a bit hesitant to recommend them is that they don't actually list the prices for the services they offer, and for me that is a bit it's a red flag for me, I must say, because when the prices are not listed, then you don't know what you're gonna be charged. And here on Crete, it's very common for people to be charged different prices depending on who it is. So I'm a bit, anyway, if you want to check them out, please, you can visit my blog, and I have their link there. You can visit them and, see if it's something that you'll be interested in. I also want to talk a little bit about the health insurance, because somebody asked this question, and what I can say is briefly is that for us, I can only share our story. For us, my husband was able to actually tie his Danish national health insurance to the Greek national insurance, so that way things sort of work out. If we need something, then it works out that the Danish national health insurance works with the Greek national health insurance. And our friends who are from the UK, the ones I'm talking about where the husband had an accident, they're actually with the national health insurance in the UK, and they were able to do something similar. So, but if your country cannot work with the Greek national health insurance, then I think you will need a private health insurance, and we know that could be quite costly, but you will need that if you cannot, of course, use the Greek national health insurance. Now, if you're working here, of course, and you're contributing, you are covered. First of all, you're covered even some dental treatment and even eye treatment, you're covered, but you have to go to the facilities where they work together, of course, with the national insurance. So I also want to talk a little bit about the nursing homes here on the island. I have tried to do a bit of research, and when I was doing research, I came across this report where there's a nursing home here in Hanya that was closed down, and the management was put under arrest because of the mistreatment of the residents. You can read that report as well on my blog. I have linked it there. So when we were discussing this issue with my husband and some of our friends, we came to a conclusion that maybe it wouldn't be such a good idea to end up in a nursing home here on the island. Well, based on the ones that I have checked out, I feel like the island needs, high quality nursing homes, for the elderly. And I suppose as things progress slowly, things will of course get better. But currently, especially on this side of the island where I am, as I said, in Hanya, that nursing home was in so much demand that the people are just coming but then there's a lady who conducted like an investigation after her mother had passed away in the care of the nursing home, and that's how the report came out. So I think for those of you who are looking to retire on the island, maybe you should think about if it happens that you will need to be in a nursing home or to have assisted living. I think that is something you have to think about because if you don't have family members here who can, check up on you and see how things are going, if they're taking good care of you at the nursing home, yeah. So anyway, I just wanted to touch on that. So another question that was asked on one of my blog posts is that if you need to register with the GP when you move to the island. Okay, so the GP we've been using, we haven't actually like officially registered with him, but he's our doctor, so we usually go there, and then if he needs to refer us to somewhere else, then we, you know, it happens like that. So I don't think like it's necessary for you to actually register with the GP, although you can go, if you like, you can go to your nearest GP and then just sort of like I haven't actually had the chance to ask our doctor if there is like a system where we are supposed to register, but he's got our details. My husband told me as soon as he moved here, that's where he went, and that's where even when I moved here, that's where we've been going. So, but I must mention also that when you are referred to a specialist, you don't have to wait for a long period of time to see the specialist. So I think that's a plus, because we have some friends of ours from the UK that have been waiting for months to see a specialist. So here on the island, if you're referred to a specialist, you are able to see the specialist without waiting like a long period of time. Actually, we've had cases where we were referred to a specialist and we were able to make the appointment, you know, we were given appointment even 2 days later or even the following day. So that is a good thing. And I hope this information will help you, because obviously it's something that you need to know. It's not, I don't think it's absolutely necessary for you to register with the GP, but of course you can go to your nearest doctor and then that will be your doctor. Please continue supporting me. And also, if you have information actually that could help, because I have seen people who have come you know, to my videos, and they have actually shared a lot of helpful information. So thank you so much, guys. This is a community. As people who live here on the island, it's very important that we help those ones who are actually planning to come and live here on the island. You know, those ones who are looking to retire, those ones who are looking to come here and maybe work or just live on the island. It's very important that we give them helpful information. It's all about helping each other and sharing free information. That's what it's all about. So anyway, I had taken some notes so I don't forget anything, even though I know I cannot, you know, share everything that I want to share, because the video will be too long. It's already too long. But I hope you get the idea of what I'm trying to say. The healthcare is good. The medical facilities are highly equipped. But I feel like there is a bit of, when it comes to staff and especially nurses, because as I said, they have those, they call them technicians. Those are actually people who are sort of like in charge of administering medication and drawing blood for tests and things like that. So they are not actually nurses. When it comes to private hospitals, obviously, because you're paying for the services, then of course you should be able to have, you know, nursing services. But when it comes to public hospitals, that is a different story. And when it comes to like emergencies, the emergency services are offered free of charge in public hospitals. I have also listed some numbers, and I'm gonna list them below, like the numbers you can call, like ambulance and police and things like that. So I think those will be also helpful. But I think I have shared enough in this video. Please like it, share, comment, and I will try as much as I can now to, you know, to keep the content coming, and I'm going to share the things that I have learned while I was away. There were a lot of things happening. That's why I wasn't able to create content. So I think I have a lot of helpful information that I'm gonna be sharing as we move forward. So I wish you a good summer. I think now summer is starting soon. We are getting good weather, so that's good. And thank you so much, and I shall see you on my next one. Yes.